And now on the line is Breda Gahan. Breda is a global health and HIV and AIDS advisor, and she is no stranger to this program on Near FM. Breda, good afternoon and welcome back to Near FM.
Good afternoon, Darren, and nice to talk to your Near FM listeners.
Alright, cool. Breda, our last interview on Near FM was last December about World AIDS Day 2024, and in our last interview we spoke about Lenacapavir. As it has been a while since our last interview, Breda, can you remind our listeners, please, that is for those who don't know, about what Lenacapavir is and why it is in the news a lot in the last week or so?
Yes, Darren, and thanks for your interest in this important topic. Lenacapavir is a newly approved medication to prevent HIV infection that can be injected twice a year. So although we've had PrEP, pre-exposure prophylaxis, which is oral daily medications that have been available for a few years now, the emergence of Lenacapavir offers a much easier and longer lasting way to prevent HIV infection. Like I said, it's an antiretroviral drug given as an injection in a person's arm, thigh or stomach 6 monthly. As we know, there is still no HIV vaccine or cure for AIDS. And I think I mentioned in December that Lenacapavir was the biggest exciting news story during the International AIDS Conference in Munich, where I participated last year. It has been proven to be 99% effective in stopping new HIV infections from sex. Like I said, it's not a new drug. It's been approved by the FDA in the United States for multi-drug resistant HIV treatment since 2022. But the Purpose 1 clinical trial was the first to test it for HIV prevention. And as we all know, HIV prevention is much more cost effective than HIV treatment, which is for life for any person living with HIV. And looking at the problem, I mean, I did check the data to see if there was any new data. It's hard to imagine that we're now 44 years into the HIV and AIDS epidemic since 1981. The scale of the global HIV and AIDS epidemic is still immense, Darren, although it's not in the headline news these days. Of the almost 40 million people living with HIV today, over 9 million of these people are still not accessing life-saving treatment. And last year, over 500,000, 630,000 people died of AIDS-related illnesses, in fact. Even worse, 1.3 million people around the world newly acquired HIV last year, which is yesterday, today, tomorrow, 3,600 new HIV infections a day among adults and children. And I read in the Lancet a couple of weeks ago that in at least 28 countries today, the number of new HIV infections is on the rise. Irish AIDS Day has just passed, Darren, was June the 15th, and I was at the AIDS Memorial Monument ceremony on the Saturday 14th in the Phoenix Park, organised by community workers from local organisations including ASSET, Rialto Community Drugs Team, HIV Ireland, Canal Communities Local Drugs and Alcohol Task Force, Citywide, Midwest Regional Drugs and Alcohol Task Force, ISCA and others, and women mostly involved with the making of the Irish names AIDS quilt in memory of the people who died of AIDS in the 1980s and early 1990s before treatment became available and effective in Ireland. And I checked the data for this year so far, Darren, up until the end of May 2025. There have been 349 new HIV cases diagnosed in Ireland, which is about 2 a day. So again, yesterday, today, tomorrow in Ireland, 2 new HIV cases a day diagnosed. Globally, 3,600. And there's still no cure for AIDS. Treatment with antiretroviral HIV medication is for life.
I know you said there a couple of minutes ago, Breda, that there's no 100% vaccine for HIV, but I correct me if I'm wrong, but I think Lenacapavir is kind of, I know it's a miracle drug and it's kind of a vaccine, but it just means that you have to take it twice a year, for every year basically of your life. So it's kind of a vaccine in some way. But Breda,
Yes,
who is it targeted at in particular, Breda, or is it targeted at everyone?
well, all individuals at risk and vulnerable to acquiring HIV, Darren, so depending on lifestyle, exposure, obviously vulnerable people among the gay, trans, non-binary people, sex workers, women and men who are exposed to unprotected sex by partners, and many people still don't have access to or want to use condoms, male or female condoms. Lenacapavir, like you said, is easier to administer. Each dose lasts longer than daily PrEP compared to other medications. And it means fewer appointments each year, like just 2 to acquire the medication to maintain the same degree of protection. And it's especially important for poorest people working daily on low wages to earn a living to survive, and women whose partners will not use protective condoms. They can go discreetly to the health centre or local hospital and not say what they're going for, and it can be for family planning, child spacing, other services. I mean, female condoms, which can also offer protection, like male condoms, against sexually transmitted infections, HIV transmission, and unintended, unplanned pregnancies, are not easily accessible in many countries today, including in Ireland, but especially in low-income countries in Africa and Southeast Asia.
Okay, this is another big question, Breda, but although Lenacapavir could potentially end HIV around the world, I believe getting the drug to the people who need it the most is not guaranteed to happen anytime soon, isn't that, Breda?
Unfortunately not, Darren. Availability, access and affordability, are critical to save lives. Lenacapavir in the US currently carries a price tag of more than $28,000 per person per year. So for most people, especially in low and middle income countries where the virus is spreading most rapidly, this is prohibitively expensive. And the new US administration's sudden termination of various funding for global HIV prevention and treatment programs poses a major challenge, both within the US and beyond, with the underfunding of PEPFAR, the President's Emergency Plan for AIDS Relief, started in 2003 under Reagan, I think it was Reagan at the time, a Republican government, and the underfunding of the WHO and UNAIDS HIV response programs. And I just mentioned to you there, Darren, before we started, that today's headline in the New York Times, I just spotted it literally before we started speaking, that the promise of victory, this is the headline, the promise of victory over HIV fades as US withdraws support. As the new drug, Lenacapavir, gives almost complete protection against the virus, was to be administered across Africa this year, now much of the funding for that effort is gone, because we need the production costs, the transport costs, logistics, health workers to administer it, and then people trusting it to take up Lenacapavir even when it becomes available. But unfortunately, with the shortfall in funding now, this will be a huge challenge to roll it out anytime soon, even if it became available at lower prices.
I believe a lot of the new HIV cases are actually from Africa, and particularly amongst young women, isn't it, Breda?
Yes, in terms of young women, 15 to 25, in terms of vulnerability, partners who don't want to use condoms, unprotected sex, sometimes transactional sex for survival, to get food on the table. Girls are particularly vulnerable, and in view of all the conflicts ongoing in Sudan, Ukraine, Southern Africa, West Africa. It's particularly difficult where rape is sometimes used as a weapon of war in these countries. You know, I mean, an affordable version could become a reality, and I read in the Lancet HIV journal just last month that a generic version of this drug could be produced for just $25 yearly. Okay, that might not include transport costs to the developing countries, but in terms of production, $25 a year. And India, as we know, could produce generic versions of Lenacapavir under licensing from Gilead, the main pharmaceutical manufacturer. Production, fair pricing and access to injectable Lenacapavir remain barriers to access, uptake and use in many low-income countries still, in even Asia and Africa. And India, you know, is in Asia. China probably could produce a generic version. Resourcing and funding, the HIV response has fallen off in the last couple of years. In fact, warranting more advocacy and activism now than in the last decade. And in terms of shrinking funding, I mean, this is holding back progress. And we're seeing a rise of infections in, like I said, 28 countries, certain regions, and even in higher income countries like Ireland. We're not beyond new infections today in 2025. Just 2 years ago, the latest data in terms of resources available, almost 20 billion, it dropped by 5% from 2022, and almost 30 billion for the responses needed in 2025. You know, with the global focus on, sadly, conflict in Ukraine, arms purchasing by Russia, Israel, use of weapons in Iran, Palestine. I mean, the AIDS industry, the arms industry, you know, is using up a lot of resources that could be available to support global health, including prevention and treatment for people living with HIV to live positively. We're supposed to have ended the HIV and AIDS epidemics by 2030. I mean, that's just 4 years away now. We're not on track, and it's very disappointing that it's only people like yourself, Darren, near FM, maybe on Irish AIDS Day, which was the 15th of June, coming up to World AIDS Day again this December, the 1st of December. But if it's not close and personal and people don't know people living with HIV, they think it's not their problem, and it's not worth, you know, considering in terms of resourcing and finding a solution to. But it's always, Darren, for me, you know, like I say, HIV is an acronym, human immunodeficiency virus. Still, HIV, hope is vital. And like I said, progress before in the last 40 years, since, you know, I first worked in St. James's Hospital when everybody died of AIDS in the early to mid 1980s. It's amazing how far we've come, and we now have the slogan, U equals U. Undetectable equals untransmissible. If I take my medication daily, if I'm living with HIV, I become undetectable, and I am not likely to transmit HIV to my sexual partner. HIV is technically 100% preventable. Lenacapavir, I believe, can be an important new tool in the prevention of HIV if made available to all who need it soonest. Nobody should be getting infected with HIV or dying of AIDS anywhere from Afghanistan to Ireland to Zimbabwe in 2025, Darren.
I read an article on the Guardian newspaper a couple of days ago about Lenacapavir Breda. The article was published last week, and it said in the article that the manufacturer of Lenacapavir have actually gone a good way in making the drug affordable to a lot more people. And as you said, a generic form could be made available possibly for $25, which would be fantastic. But as you just also mentioned as well, like there does need to be a substantial increase for funding for HIV services in general in many countries around the world, if not every
and
country.
education with young people, like even young people in Zambia, Zimbabwe, Uganda, South Africa, countries worst affected when I started going there in the early 1990s. You know, young people then sadly saw so many parents die, teachers, engineers, truck drivers, children themselves who were infected from mothers. Young Africans today do not remember that epidemic in terms of the funerals. Like I did my research on HIV when I was doing my master's in Liverpool in 1994. Every day there were so many funerals. And people thought I'd come to help find a cure. I had to explain that actually I was coming to work on how to do better on prevention, because medications to treat HIV weren't easily available at that time in Africa. And young Africans today do not remember, luckily for them, they don't remember the worst days in Uganda, Tanzania, Zambia, Zimbabwe, South Africa, and other countries. So a whole education program. And it needs to be at primary school level. Very few people in poorest countries, where concern is working, ever get to secondary school. So if they don't get the education and information on prevention, how to protect themselves in an age-appropriate way at 10, 11, 12, 13 years of age, they miss out on that education. And before they know it, they could become infected. And then it's treatment for life, when obviously prevention would be a lot better. And now that we have, and we know that Lenacapavir is available, the miracle drug, as some people are calling it, it would be so much more cost effective to make that available than using funding to bring treatment to people who are already infected, who will need it for life. And the whole stigma issue around it I haven't even mentioned. I mean, the stigma has probably increased, I would say, in countries I've been to recently, because many people think, oh, well, HIV and AIDS, sure, that was in the 1990s, 2000s, isn't it over now? More people living with HIV than previously are afraid to talk about it. The stigma has increased, both here in Ireland and in countries overseas.
I'm aware that stigma is an issue for a lot of kind of health conditions, isn't it? Breda, you said there that like if you have HIV, it's treatment for life. But like am I right in saying in some countries or regions around the world, even if you have HIV, you mightn't actually get the treatment because the funding is not available?
Yes, almost. Of the almost 40 million people living with HIV today, so more people living positively. I mean, living means not dying, so the number should go up initially. So of the 40 million people living with HIV today, it should be almost up to 50 million, because over 9 million people in the poorest countries are still not accessing life-saving treatment. And less people are accessing treatment in Rwanda, in Burundi, in South Africa. If you read the latest New York Times article there, great pictures with it. Even in South Africa, people are going to the clinics and they're closed, some of them, and the drugs are no longer available because of the funding cutbacks from the US to the UK to Europe. So let's hope that there'll be more activism and ACT UP Dublin and ACT UP globally, and people who are not living with, myself so far as I know, not living with, but affected, you know, we need to amplify and vocalize for the needs of people at risk and vulnerable to contracting HIV, so that we can help them to stay HIV negative, which is best, and to support people living with HIV to be able to access the life-saving drugs that they need for life. Nobody wants to die of AIDS-related illnesses in 2025. Much thanks, Darren, and thanks to your listeners for tuning in.